She did fantastic, and she felt much, much better really after 6 weeks, but this is what her spine looked at 3 months. So she's done great, and this is what's possible when people do chiropractic care as well as do the exercises and the stretches along with the care. Thank you for taking the time to take a look at this video. I hope it helps demonstrate and illustrate the exercises and stretches better to you, and you can use it as a reference point. Please feel free to share this with your family and friends. Keep in mind, though, that this is not a substitute for care or for correcting somebody who already has a problem. If they already have a problem, refer them in, we'll check them out, we'll address the problem, and then that's when they start doing the exercises that it benefits the most. If people don't have a problem, these are great exercises to do to help prevent a problem. Once again, thank you, and I look forward to seeing you soon. Have doctor's patient switch real quick. Yeah, doctor's patient switch real quick. Take a look at the bottom of the earlobes.
Okay.
Okay, bottom of the earlobes might be tough with the hair.
Yeah.
Okay. And then you want to look at the top of the shoulders and see if the shoulders are even. You're doing a great job. And then you want to take a look at the top of the hips. So for him, right, he's lower here, and then his head is higher on this side. Right. And then have the patients turn to their side. Just look normal, or look forward as normal as possible. Take a look at their ear in relationship to their shoulder. In their shoulder in relationship to their hip. Right, so Erickson's here is probably a good, he's probably good. You standing normal there?
Right there?
He's probably about a ½ inch forward. If you look at the tip of my fingernail to the tip of my fingernail. Right. Yeah. Go ahead and do it on your own. I want to make sure, and then ask me, hey, am I doing it right? Am I doing it right? And then do a doctor or patient, especially if your spouses are here, right? Because you guys can go home and do this. Yeah, we did that. Well, we thought maybe too much, but no. So with you, I'm going to pull it higher with you. Okay. Can you feel that? Then you pull forward with your elbows. 5, 4, 3, 2, 1. Relax. And then I'll pull back. Then pull forward again. 5, 4, 3, 2, 1. And then relax. Nice and easy. We're not trying to rip anything here, right? When our elbows are up, not that you did anything wrong.
No.
But when our elbows are up,
No, it feels different though.
it turns on our traps. And when that happens, our neck actually gets pulled out of alignment. So people with neck problems, it's hard. They'll be, hey, I'm doing this exercise, but they're not quite doing it right because it's pulling their neck out. So what you want to do is you want to keep the elbows have to be down. If it's up here, it engages the traps. And I've seen more people with disc and neck problems not get better because they're in the gym either lifting their traps or they're not quite doing exercise. They're doing a lot of work above their head. So keep the elbows down.
Where do you feel the burn?
Right between the shoulder blades. Almost underneath the scapula.
Shoulder blades.
Yeah, right here. Here, come against the wall. Make sure you're getting it. So against the wall. So there isn't much wall space you'll find. It's sometimes tough. Right? We usually put things on it.
No, I won't take it.
Look right there.
Oh, okay.
You got it? So like right here is where you want to feel it. Let me show it on the camera here. You want to feel it right there.
Yes.
Right there is where you want. So you can do it in the air. You can do air W's. Air W's are okay. And just hold that position. Good. This is what I do when I watch you on. It seems so. This is going to be. I can tell you're going to have a little tougher. So let's come forward. Just bring your chin straight forward. Now go back with it, and then tuck it right there. Hold 5, 4, 3, 2, 1. Now
pull it down.
Now go straight forward, and then come back.
Yeah, you feel it.
Hold it, hold it, hold it. Now come forward again. I'm going to hold your shoulders. Come forward. There you go. Now go back.
Go forward.
Good. That's real good.
Okay.
Good.
No.
Come straight back. And can you go back any farther? That's about it for you, isn't it? All right, hold that. You might have to do this a different way, and I'll show you how to do this. So go forward with the chin. So bring your chin straight out to my hand. There you go. Then go straight back. Keep your shoulders there. Can you go back any farther? Go as far as you can. Far as you can, far as you can, far as you can. Right there. Hold it. Hold it. There you go. Yeah, you're getting it. You feel that tightness right here? That's what you want. Now come forward. Good. Now go back. Right there. You feel that right there? That's what you want to happen. Here, we'll get them fixed. So bring this out. What you can do is just bring that down. I'm going to show you how to do a partner stretch with it. And same thing here, we'll do the contract, relax, so we can kind of beat the 30-second rule. And what I do is I just put it here near the hip, hand on the knee, and just come forward until, okay, that's it. See, that's enough. And so she gets a little bit of a stretch, 5, 4, 3, 2, 1, and now I'm going to have her push against me, and I'm going to brace the knee, and I'm not going to let her move anywhere. And then relax, and then you can go a little bit, see how she can go farther with it?
Yeah.
And then she pushes again. 5, 4, 3, 2, 1. Relax. And then you can go a little bit farther, and then you can do one more. Now she's a lot farther than what she started, isn't she?
Yes.
Yeah. Now how does she do this on her own? So not all of us have partners to partner stretch, right?
Yeah.
Perfect. That's one way to do it, right? You bring it up, you pull on the hamstring. Ground at work, right? Looks a little corny, doesn't it? So how do you do it at work? Let me see your chair here, Wendy. You can just use your chair. You use a tire on a car, it doesn't really matter, right?
Yeah.
Get out and move around. Basically, you put the same position in the leg, right? You bend the leg, you come forward like this, and you'll feel stretch right around. So let me do it this way so you can see it better again. And you'll feel it right around the hip here.
Yes.
You just hold that position. If you don't feel that, bend the knee a little bit more. Okay? And then you feel it right around the edge of the hip. Okay?
My name's AJ Parker, and like Dr. Thompson said, I've been a patient of his for about 12 weeks ago. We met at a healthcare fair over in Bellevue, and I sat in his class about 10 weeks ago and listened to him and decided to continue my care because the results up to that point had been so positive. And what's so positive about the results are, give you a little bit of my background. I was born with a couple of rather significant birth defects, spinal birth defects, the spina bifida occulta and a spondylolisthesis. And I spent the first 2 years of my life in leg braces from the waist down. Went on, had a great, wonderful childhood, running around, athletics, high school, no problem, until one day I crashed and burned in gymnastics. And they said, oh, by the way, did you know? And 2 years later, I had my first spine operation. The spondylolisthesis, if you think of this as your lumbar vertebrae, it was kind of twisted off to the side, it pushed forward, and the little spiny protrusions, about half of those were missing. And so, and the discs were already worn away before I was 20 years old. Had that operation a year later, I had a second one, and to date I've had 9 total. It's a progressive disease, it's very debilitating, but it doesn't have to be as debilitating as a lot of people let it become. And so my story, as far as Dr. Thompson's concerned, is the power of chiropractic. For me, it is not going to be the cure-all of cure-alls. I am always going to be in pain. But the fact that I'm standing here and not in a wheelchair says tons, not just about Dr. Thompson's care, but my other healthcare providers besides. And those healthcare providers are all, at this point, alternative healthcare providers, because I was in the chronic pain care system for years, 12 years as a matter of fact. In 2002, I was on 13 different prescription medications. And at that point, I became so toxic, it just about killed me. I had to be pulled off every single one of them. And since then, I've been able to piece together a healthcare network of biofeedback, relaxation, meditation, things like that. And it wasn't until 12 weeks ago that I believe the final piece in that whole puzzle came together, and that was chiropractic care. The reason it took me so long to get to chiropractic care was all of those doctors for the past 30 years.